What's up, y'all? How y'all doing? Hope everybody's doing good today. I appreciate anybody watching this video. Thank you guys. Hope you guys are blessed. Hope you guys are having a good day so far. Really just wanted to come on here and give y'all an update. It is today is officially 6 months post surgery. Today is April 15, 2025, and I got surgery October 15, 2024. So that's exactly 6 months. Now, when I was getting surgery, my doctor told me it would take 6 months for me to be, back to being active and whatnot. And I guess, from how I progressed so far, I said that he wasn't lying, like he was truthful about it. But quite not quite 100% yet. But let me just give y'all an update as far as what I can and can't do, and how my lifts are going in the gym and everything. So first of all, big thing, I did a push-up. Now I'm gonna play that video for y'all so y'all can see. It was a bit awkward. I was kind of leaning towards my right side, the side I didn't get surgery on a bit. But, I still was able to do like a regular, normal push-up with my palms facing down. See, I've been able to do the knuckle push-ups, but the palm facing down, that was always kind of a struggle. My doctor also did say that he wouldn't risk doing push-ups with the palm facing down because it can stress the scapholunate ligament. When you do a push-up, those bones are automatically separated, whether you got surgery or not. I kind of talked about that more in the last video. So, yeah, guys, I did a push-up. So excited, so happy. I did that a week ago, or a week and 1 day ago. So I did that. Today's Tuesday. I did that on Monday last week. And I have a video for y'all, so I'm going to show it and I'm going to play it right now. But yeah, did that. And it wasn't too bad. I could probably, eventually work my way into doing some more. I haven't really tried since then, but, I'm happy with that. Progress is going smooth as far as that goes. Knuckle push-ups are fine. Pull-ups are fine. Dips are fine. No issues doing that. Now it's more just working my strength back in a sense. You know what I'm saying? So, because I did lose strength, I gained some weight as well. I've actually lost a bunch right now, but I usually walk around at 220. Back in January, I was like 250. Now I'm back down to 230. Got about like 10 more pounds to lose. But yeah, I'm super happy. Able to do pull-ups, like I said, able to do dips, knuckle push-ups fine. Just able to do one push-up as for now goes. Hey guys, I can't lie, I have been, making a lot of strides in my progress and whatnot. My lifts in the gym have been going up as well. Bench press is going back up. Dumbbells, bench press are going back up. Shoulder press is going back up. Whether that be barbell or dumbbell, they're all going up. So, which is also a good thing. I do struggle a bit sometimes to stabilize when I do dumbbell presses and when the weight is a bit heavier. So when I, try and just push myself in weight, it's a bit of a struggle and it does hurt just a bit. But the hurt that I experienced, let's say 3 weeks ago, was a lot more than the hurt I'm experiencing right now. So it is going down. So that is a good thing too as well. And yeah, guys, I mean, I really don't know what to say. I'm grateful. It has been a long process. I'm still doing rehab like every day, even though, I don't, I'm no more going to rehab, but I still have my grippers right here. This is my left hand where I got surgery on. I still, work on my grip strength and whatnot. I still have my gyro ball right here. If y'all got the surgery and recovering, you should get this for sure. But talk to your therapist first before you get it. But if y'all ever use a gyro ball, you know how it works. Still got my therapy putty. Still use that on a daily. Still do my what's it called? My bands work. So you step on the band, you do some wrist curls up, wrist curls down. I'm still doing those every day. So yeah, as far as that goes, still putting in the work. I think it's more like a long-term process. I'm trying as much as possible to make it a habit. So my wrist just becomes stronger regardless of whatever happens. So I just know I have a strong wrist, because eventually I want to be fighting again. And back to that fighting, which is a main thing for me. That is kind of where I say I'm not 100% back yet, because when you throw punches and you're absorbing impact, it travels from the knuckles to the wrist all the way here. So, the wrist has to work to absorb the impact. And obviously, I got surgery on it. So, I'm trying to work my way back into it. So, kind of what I did was last week, literally just a week ago when I did that first push up, I just started going back to the gym. I haven't gone to the boxing gym yet, but the gym I go to has a boxing bag. So, what I do is I go there and, I just started punching the bag just light punches. And obviously my hands are wrapped, I have gloves on and everything. Just started doing the light punches, kind of just to get the feel of it. I was probably punching at like 10 to 20% last week. No uppercuts, no hooks, none of that. Just straight punches, keeping it simple, just to get the feel of it. Cause my doctor did also say to give that a try. And from then last week to now, I'm probably punching at about 30, 40, maybe 50%. But this is on the heavy bag though. So, there's progress there. 10% to like 30, 40%. 50 if I really want to push it. But, I try not to push it too hard. I'm still trying to work my way back up to throwing 100% punches. Obviously, I'm throwing power on my right, taking it slow and easy on the left, trying to just work my way back into it. Speed bag is fine, reflex bag is fine, all that is fine. It's really just, having the impact go from the knuckles to the wrist. So I'm trying to build that tolerance back up. For my guys that do fight, if you know the aqua bag, I'm able to go a lot harder on the aqua bag because it's, I guess, softer. It displaces the force a lot better. I'm probably able to punch that like 80% on this wrist that I got surgery on, which is kind of crazy. On the regular heavy bag, I'm probably like 40. So that just shows you like it just needs time to be able to work its way up to punching hard surfaces again and absorbing the impact. So that's kind of where I'm at right now. I'm gonna give y'all an update. I'm probably trying to make a video of me boxing, shadow boxing as well. That's completely fine, no issue with that. Probably trying to show y'all a video of me on the heavy bag so y'all know I'm able to take impact as well. I'll try and get that and show y'all. But y'all heard the video of me doing the push-ups, so y'all know if you're getting the surgery, it's possible. Like it's a tough road. This has been hard. Very, very hard. I can't lie. Like I struggled with this. Like this recovery has sucked. Still sucks sometimes to this day. Still gets sore after workout sometimes. It's getting better regarding that factor, but it just takes time. So, if you're thinking about getting the surgery or you got the surgery, just be patient with it. I'm still being patient on a daily. I'm not trying to rush the weights. I'm not trying to rush going back to, full on sparring. I'm trying to be 100% before I even take those huge leaps, so just working my way up on a daily. So, yeah, guys, if y'all have any more questions for me, just leave it in the comments. I read every comment. I don't have that much subscribers. I'll see your comment. So, yeah, just let me know if y'all want to see if I could do something or not. You have anything in particular, just ask. I'd be more than happy to help. But yeah, everything's going good so far. Gym, we good. Boxing, we working our way back into it. And let me just show y'all, I know I always do this. Let me just show y'all my range of motion again. Probably did lose a good amount, like 90 degrees to like 70 on this wrist. I got surgery on it backwards, probably about the same. But the things I could probably push it, to be like flat. Let me, oh shit. I could probably make it lay flat if I push it, but not pushing it, it just stays up. But that just shows y'all, it's possible. I'm able to get down on my, what's it called? On my palms, so which is also a good thing. But yeah, I still do stretches and everything. As far as this goes, this is probably where I lost the most range of motion. Y'all can see that. It's crazy. This is a lot. This is like what? 80 to like 30. Lost a lot of range of motion there. And then the other way, kind of like the same. But yeah, y'all, I appreciate every one of y'all. If you have any questions for me, just let me know. Y'all stay blessed. Y'all stay safe. Y'all be great. And I'm gonna see y'all. Peace.